I read somewhere recently that kind of the inverse of how for a long time the medical community was coding heart attack symptoms as if only they only affected men. And only in the last, what, maybe 20, 30 years, we started realizing that um, women show signs of a pending heart attack differently. And it
Yeah.
seems we've been doing the inverse for mental health, where we've been coding these symptoms of depression as if it's presenting only in women. And then I think they changed some sort of diagnostic tool for men where they ask them different questions like, are you isolating more? Do you find less joy in things? And so there became a whole different criteria list for men. And once they started deploying that checklist, they started finding the depression levels in men were way higher than they anticipated, probably around the same or more of women. And I didn't know that the men's mental health, um, I guess, group that you run in UBC. I didn't know it was the only one in Canada, because I've been in contact with the Men's Suicide Research Lab in Scotland, and I was wondering, have you guys done any work with them? Because I've spoken to Dr. Susie Bennett from there several times, seeing her actually recently. She happens to be in Barcelona, and the work they're doing seems super profound, and it seems like a perfect fit for what you guys are trying to do. Have you ever connected with that group?
No, but perhaps you could connect us.
Yeah, I would be happy to, because I mean, I believe they did a meta analysis of, like, I think 70 studies on the matter, and so I was reading through a lot of the material, and there's a lot, I don't know where they did some of these surveys or studies, but you see a lot of Canadians pop up as well, and you see a lot of quotes from these men that are going through these despondent times, and they feel like, oh, I don't feel I can tell my friend or my spouse or anyone that they think I'm all happy, but at home I'm crying at stoplights,
Yeah.
right? And suffering in silence is, that's the worst part, because you feel like if there's no one else you can reach out to, well, then kind of what's the point of you being around? And it kind of goes down this path where, like you said, they feel like the best answer is for them not to be around, which is a devastating thing, to think that someone you love could be feeling that.
It's horrible, actually. Often what I say is that silence kills. We keep our pain inside, and it's going to eat us up one way or another. And sadly, for far too many, and in fact, one is too many. But there's
Yeah.
a lot of men that they feel they have reached a point where their pain is intolerable. They feel like there's such a tremendous burden on those around them that it's better off not only for himself, but for those other people in his life for him not to be around anymore. And we need to
Right.
change that. And often underlying that silence, and you were alluding to it, is shame. Shame that
Hmm.
perhaps we violated the masculine norm of what it means to be a strong, good man, and shame that we can't be there in the way we need to be or want to be for our family and friends. Shame that we feel ill anyway, as if men are somehow impervious to suffering and pain. But we're human beings. We feel pain. We will suffer. But none of us should ever have to feel like we need to tackle that alone. Human beings are social animals. We're meant to have people in our lives, and we need people to be close to us. We need to be able to rely on people when things become too much for ourselves.